Welcome back to NCLEX Made Easy 91. Rocket! Today we're diving into 50 challenging nutrition MCQs that will push your critical thinking to the limit. These aren't just regular questions, they're designed to sharpen your exam skills, boost your confidence, and make sure you walk into your test fully prepared. So grab your notebook, get comfy, and let's see how many you can get right. Ready? Let's go! 1. Nutrition is best defined as which of the following? A. The scientific study of nutrients in food and how the body uses them. B. The art of cooking delicious meals. C. The measurement of body weight and height only. D. The avoidance of fats and oils in the diet. Correct answer A. The scientific study of nutrients in food and how the body uses them. Rationale. Nutrition examines nutrients and their roles in body function, health, growth, and disease. Strategy. Match keywords in the STEM, study, nutrients, body uses, to the option that mentions both science and utilization. 2. Which term refers to chemical substances in food used by the body for growth, maintenance, and repair? A. Calories. B. Nutrients. C. Hormones. D. Enzymes. Correct answer B. Nutrients. Rationale. Nutrients are chemical substances in food that the body uses for growth, repair, and maintenance. Strategy. Remember, nutrients equal nourishment. 3. Which professional applies nutrition principles in planning meals for the sick? A. Nutritionist. B. Dietitian. C. Chef. D. Pharmacist. Correct answer B. Dietitian. Rationale. Dietitians use nutrition knowledge to plan therapeutic diets for patients. Strategy. Dietetics, dietitian for clinical meal planning. 4. An adequate diet is best described as one that A. Excludes fats and oils completely. B. Contains only plant-based foods. C. Contains the 6 classes of food in the right proportion. D. Focuses mainly on carbohydrates for energy. Correct answer C. Contains the 6 classes of food in the right proportion. Rationale. Adequate diets include all food groups in correct amounts to meet needs. Strategy. Look for the right proportion phrase. 5. Which statement about macronutrients is correct? A. They include vitamins and minerals. B. They are needed in tiny amounts. C. They include carbohydrate, protein, fats and oil, and water. D. They are not energy yielding. Correct answer C. They include carbohydrate, protein, fats and oil, and water. Rationale. Macronutrients are required in large amounts. CHO, protein, and fat supply calories for energy. Strategy. Eliminate micronutrient examples. 6. Energy-yielding nutrients include which set? A. Carbohydrate, protein, fats, and oil. B. Vitamins, minerals, water. C. Vitamins, carbohydrate, water. D. Minerals, fats, and oil, water. Correct answer is A. Carbohydrate, protein, fats, and oil. Rationale. These 3 provide the body with calories for energy. Strategy. Recall 3 macros give kcal. 7. A nurse promoting good nutrition in the community should prioritize which activity? A. Encouraging exclusive reliance on imported foods. B. Demonstrating methods of food preparation that conserve nutrients. C. Discouraging breastfeeding to prevent infections. D. Advising avoidance of all oils. Correct answer is B. Demonstrating methods of food preparation that conserve nutrients. Rationale. Preserving nutrients is key to maximizing food value. Strategy. Choose the option that reflects education and prevention. 8. Which historical observation lets the prevention of scurvy among sailors? A. Eating vinegar daily. B. Drinking salt water. C. Consuming citrus like lime. D. Fasting during voyages. Correct answer is C. Consuming citrus like lime. Rationale. Dr. James Lynn's trial proved citrus prevented scurvy. Strategy. Associate scurvy with vitamin C from citrus. 9. Carbohydrates provide how many kilocalories per gram? A. 2 kilocal. B. 4 kilocal. C. 7 kilocal, D, 9 kilocal. Correct answer is B, 4 kilocal. Rationale: CHO and protein each supply 4 kilocal per gram. Strategy: remember 4-4-9 rule. 10. The end product of carbohydrate digestion is primarily A, fructose, B, lactose, C, glucose, D, maltose. Correct answer is C, glucose. Rationale: glucose is the main usable form of carbohydrate for the body. Strategy: think brain runs on glucose. 11. Which enzyme begins the chemical breakdown of starch in the human digestive system? A, pepsin, B, salivary amylase, C, pancreatic amylase, D, maltase. Correct answer B, salivary amylase. Rationale: salivary amylase nitialin hydrolyzes starch into maltose and dextrins in the mouth. Strategy: focus on the first site of starch digestion, the mouth. 12. Which disaccharide is composed of one glucose molecule and one galactose molecule? A, sucrose, B, lactose, C, maltose, D, trellose. Correct answer B, lactose. Rationale: lactose is glucose plus galactose. Sucrose is glucose plus fructose. Maltose is glucose plus glucose. Strategy: L in lactose equals L in galactose. 13. Which physiological role is directly attributed to plasma proteins such as albumin? Regulating colloid osmotic pressure to maintain intravascular fluid balance. Serving as the major storage form of glucose in the liver. Acting as the primary carrier for oxygen in red blood cells. Catalyzing the breakdown of triglycerides. Correct answer A. Regulating colloid osmotic pressure to maintain intravascular fluid balance. Rationale: plasma proteins keep fluid within the vascular compartment by osmotic pull. Strategy: think protein pulls water in vessels.
14. A diet lacking adequate protein but sufficient calories is most likely to cause which condition? A, pellagra, B, beriberi, C, kwashiorkor, D, marasmus. Correct answer C, kwashiorkor. Rationale: kwashiorkor results from protein deficiency with adequate energy intake. Marasmus is deficiency of both protein and calories. Strategy: key sign in kwashiorkor, edema. 15. Fats and oils provide how many kilocalories per gram? A, 3 kilocalories, B, 4 kilocalories, C, 7 kilocalories, D, 9 kilocalories. Correct answer D, 9 kilocalories. Rationale: fat is the most energy-dense macronutrient at 9 kilocalories per gram. Strategy: remember fat is fine at 9. 16. The primary site of fat emulsification by bile salts is the A, mouth, B, stomach, C, duodenum, D, colon. Correct answer C, duodenum. Rationale: bile salts emulsify fat in the duodenum, increasing surface area for enzyme action. Strategy: pair bile with duodenum. 17. Which of the following is a major function of dietary fat? A, inhibiting the absorption of vitamins A, D, E, and K. B, providing insulation and cushioning for body organs. C, serving as the main source of glucose during fasting. D, acting as a coenzyme in metabolic reactions. Correct answer B, providing insulation and cushioning for body organs. Rationale: fat protects organs, stores energy, and aids fat-soluble vitamin absorption. Strategy: eliminate non-fat functions like coenzymes, vitamins, and glucose supply, CHO. 18. Vitamins and minerals are best described as A, macronutrients needed in large amounts, B, micronutrients essential for metabolic processes but needed in small amounts, C, non-essential dietary components, D, primary energy sources. Correct answer B, micronutrients essential for metabolic processes but needed in small amounts. Rationale: they regulate biochemical reactions without providing calories. Strategy: match small amount with micronutrient. 19. The earliest clinical sign of vitamin A deficiency is A, xerosis of the skin, B, night blindness, C, keratomalacia, D, Bitot spots. Correct answer B, night blindness. Rationale: impaired dark adaptation is the earliest symptom. Later stages affect the cornea. Strategy: go for the first symptom, not advanced signs. 20. In pregnancy, excessive vitamin A supplementation is discouraged because A. It may cause fetal malformations. B. It interferes with iron absorption. C. It reduces placental hormone production. D. It prevents weight gain. Correct answer: A. It may cause fetal malformations. Rationale: vitamin A toxicity is teratogenic in high doses during pregnancy. Strategy: think too much A equals abnormal anatomy. 21. Vitamin D deficiency in children is known to cause A. rickets, B. pellagra, C. scurvy, D. osteoarthritis. Correct answer: A. rickets. Rationale: rickets is characterized by defective bone mineralization due to low vitamin D. Strategy: D for development of bones. 22. WHO recommends exclusive breastfeeding for approximately how long? A. 0 to 2 months, B. 0 to 4 to 6 months, C. 0 to 9 months, D. 0 to 12 months. Correct answer: B. 0 to 4 to 6 months. Rationale: exclusive breastfeeding from birth until around 6 months meets infant nutritional needs. Strategy: remember, 6 months, strong start. 23. Compared to cow's milk, human milk protein has what approximate casein to whey ratio? A. 76 to 24, B. 40 to 60, C. 100 to 0, D. 60 to 40. Correct answer: B. 40 to 60. Rationale: human milk has more whey, albumin or globulin, than casein, aiding digestion. Strategy: human equals high whey content. 24. The major immunoglobulin present in human breast milk is A. immunoglobulin G, B. immunoglobulin A, C. immunoglobulin M, D. immunoglobulin E. Correct answer: B. immunoglobulin A. Rationale: A provides mucosal immunity, protecting infants against pathogens. Strategy: A for against infections. 25. Colostrum differs from mature breast milk in that it A. has higher fat content, B. is richer in antibodies and protein, C. contains less immune protection, D. is identical in composition to mature milk. Correct answer: B. is richer in antibodies and protein. Rationale: colostrum provides immune factors crucial for newborn defense. Strategy: identify first milk benefits. 26. During pregnancy, which nutrient requirement increases most to support increased blood volume and fetal development? A. Sodium, B. Iron, C. Vitamin A, D. Iodine. Correct answer: B. Iron. Rationale: maternal blood volume expansion requires additional iron to prevent anemia. Strategy: think pregnancy, more blood, more iron. 27. The approximate daily protein requirement for a pregnant woman is A. 30 grams per day, B. 45 grams per day, C. 60 grams per day, D. 90 grams per day. Correct answer: C. 60 grams per day. Rationale: pregnancy increases protein needs for maternal and fetal tissue growth. Strategy: remember, pregnancy, protein peak at 60. 28. A lactating mother requires an additional daily energy intake of about A. 300 kcal per day, B. 500 kcal per day, C. 700 kcal per day, D. 1000 kcal per day. Correct answer: D. 1000 kcal per day. Rationale: lactation demands increased energy with approximately 130 calories per 100 milliliters of milk. Strategy: link milk making to high-cal needs. 29. Human breast milk is approximately what percentage water, making additional water unnecessary for the infant in the first 6 months? A. 60%, B. 70%, C. 80%, D. 90%. Correct answer: C. 80%. Rationale: the high water content meets infant hydration needs without extra fluids. Strategy: 80% equals enough hydration. 30. By 6 months of age, an infant's birth weight is expected to A. remain the same, B. double, C. triple, D. decrease by 10%. Correct answer: B. double. Rationale: normal growth doubles birth weight by 6 months, triples by 1 year. Strategy: 6 equals x2, 12 equals x3 rule.
31. Which age group requires the most energy per kilogram of body weight? A. Infants. B. Toddlers. C. Adolescents. D. Adults. Correct answer A. Infants. Rationale: rapid growth and high metabolic rate make infants' per kilogram needs the greatest. Strategy: fast growth equals high kcal per kilogram. 32. The approximate daily calcium requirement for toddlers is A. 200 milligrams per day, B. 400 to 500 milligrams per day, C. 800 milligrams per day, D. 1200 milligrams per day. Correct answer B. 400 to 500 milligrams per day. Rationale: supports bone and tooth mineralization during early growth. Strategy: choose mid-range value per guidelines. 33. Adolescents have higher requirements for which two nutrients? A. Iron and calcium, B. Vitamin C and iodine, C. Sodium and potassium, D. Zinc and vitamin K. Correct answer A. Iron and calcium. Rationale: needed for blood volume expansion and bone growth during puberty. Strategy: think teen, taller, and more blood. 34. For elderly adults, diet should emphasize A. High fiber and reduced total energy intake, B. High sugar and saturated fats, C. Very low protein, D. Unlimited sodium. Correct answer A. High fiber and reduced total energy intake. Rationale: prevents constipation and matches reduced metabolic rate. Strategy: think fiber up, calories down. 35. Weight for height Z-score is used to assess acute malnutrition in children of what age range? A. 0 to 23 months, B. 0 to 59 months, C. 2 to 10 years, D. 5 to 15 years. Correct answer B. 0 to 59 months. Rationale: covers under 5 children, the most vulnerable to acute malnutrition. Strategy: under 5 is a WHO standard group. 37. A key government strategy to improve nutrition status in Nigeria is implementing national nutrition policies and programs. B. Increasing importation of processed foods. C. Discouraging breastfeeding campaigns. D. Removing micronutrient fortification laws. Correct answer A. Implementing national nutrition policies and programs. Rationale: policy frameworks address malnutrition systematically. Strategy: choose the broadest systemic measure. 38. Which non-nutrient factor strongly influences individual food choices? A. ATP synthesis rate, B. Cultural background, C. Blood group type, D. Eye color. Correct answer B. Cultural background. Rationale: culture, religion, income, education, and availability all affect diet. Strategy: consider social and environmental factors. 39. Dietary advice for diabetic patients generally emphasizes A. Moderating carbohydrate intake and choosing low-calorie foods, B. Avoiding protein-rich foods, C. Increasing saturated fats, D. Eliminating all fruits and vegetables. Correct answer A. Moderating carbohydrate intake and choosing low-calorie foods. Rationale: controls blood glucose while maintaining balanced nutrition. Strategy: think glycemic control and weight management. 40. Cigarette smokers have an increased requirement for which vitamin? A. Vitamin C, B. Vitamin D, C. Vitamin K, D. Vitamin B12. Correct answer A. Vitamin C. Rationale: smoking increases oxidative stress, depleting vitamin C levels. Strategy: link smoking to antioxidants. 41. The main carbohydrate found in milk is A. Lactose, B. Sucrose, C. Maltose, D. Fructose. Correct answer A. Lactose. Rationale: lactose is the principal sugar in milk, providing energy. Strategy: lacto means milk sugar. 42. Deficiency of vitamin C causes which disease? A. Pellagra, B. Beriberi, C. Scurvy, D. Rickets. Correct answer, C. Scurvy. Rationale. Vitamin C is essential for collagen synthesis. Its deficiency leads to scurvy. Strategy. Classic link, C to collagen to scurvy. 43. Pellagra, characterized by dermatitis, diarrhea, and dementia, results from a deficiency of A. Niacin, B. Thiamine, C. Riboflavin, D. Folate. Correct answer, A. Niacin. Rationale. Pellagra is caused by niacin deficiency and is summarized by the 3 Ds. Strategy, N for niacin, and neuro plus skin plus gut symptoms. 42. Beriberi is due to a deficiency of which vitamin? A. Thiamine, B. Niacin, C. Riboflavin, D. Pyridoxine. Correct answer, A. Thiamine. Rationale. Thiamine, B1, deficiency affects the nervous and cardiovascular systems. Strategy, beriberi to B1. 45. Sodium functions mainly as A. The principal extracellular cation maintaining fluid balance and nerve conduction. B. The main intracellular cation controlling metabolic enzymes. C. A component of hemoglobin. D. A cofactor for thyroid hormone synthesis. Correct answer, A. The principal extracellular cation maintaining fluid balance and nerve conduction. Rationale. Sodium regulates extracellular volume, pH, and membrane potential. Strategy, Na plus outside the cell. 46. Potassium is mainly located in which body compartment? A. Intracellular fluid, B. Extracellular fluid, C. Plasma proteins, D. Bone tissue. Correct answer, A. Intracellular fluid. Rationale. Potassium is the primary intracellular cation essential for nerve and muscle function. Strategy. K+ lives inside cells. 47. Which 2 minerals are the main components of bone? A. Calcium and phosphorus, B. Sodium and chloride, C. Iron and iodine, D. Zinc and copper. Correct answer, A. Calcium and phosphorus. Rationale. Hydroxyapatite crystals in bone contain calcium and phosphate. Strategy. Ca, phos, for hard parts. 48. Which factor enhances calcium absorption? A. Vitamin D and lactose, B. High oxalate intake, C. High phytic acid intake, D. Excess dietary fat. Correct answer, A. Vitamin D and lactose. Rationale. Vitamin D increases calcium-binding proteins. Lactose forms soluble complexes. Strategy. Think facilitators, not inhibitors. 49. The primary role of iodine in the human body is A. A component of thyroid hormones that regulate metabolism, B. Oxygen transport in hemoglobin, C. Bone mineralization, D. Antioxidant protection of membranes. Correct answer, A. A component of thyroid hormones that regulate metabolism. Rationale. Iodine is needed for thyroxine and triiodothyronine synthesis. Strategy. Iodine to thyroid to metabolism. 50. One advantage of breastfeeding is that breastfed infants generally have A. Fewer infections and shorter illness duration due to protective factors, B. Higher risk of gastrointestinal infections, C. No need for vaccination, D.
slower cognitive development. Correct answer, A. Fewer infections and shorter illness duration due to protective factors. Rationale: antibodies and immune cells in breast milk protect infants from disease. Strategy: choose the option highlighting immune protection.
Great job making it through all 50 questions. Remember, the more you practice, the more confident you'll feel on exam day. If you found this helpful, hit that like button, subscribe, and turn on notifications so you never miss our next NCLEX challenge. Your success is our mission here at NCLEX Made Easy 91. Until next time, keep learning, keep practicing, and keep winning.